Good morning, everyone. With us today is John Woodrich, the Chief Executive Officer of Bryan Medical Center, and Sara Morris, the Operational Director for the Bryan Physician Network. Sara's been with us over 20 years, and she was the point person in standing up our walk-in clinic at Urgent Care, and we're going to share a little bit about that today. It remains a very important piece of or cog in this machine here. Our daily census is 361. Just a reminder, we have 640 licensed beds, 538 available to hold patients. Our easy visit screening questionnaires completed are 7,878, resulting in 1,981 easy visits, and 903 have used the COVID-19 promo code. At Bryan Medical Center, we have tested 149 individuals to date. Thankfully, 88 of those are negative. We have 3 positives, and 58 results are pending. Of those 58, 16 are currently being treated as inpatients at Bryan. With our drive-through clinic, we have completed 466 COVID tests with 4 positives. 162 are negative, and 300 are pending. Sara will share a little bit about this, but one piece that we're going to bring to you now, and perhaps we should have all along, is our walk-up respiratory clinic at Bryan Urgent Care. We have conducted 69 COVID-19 tests there, with 2 of them resulting in positives, and we are currently sitting on 18 that are pending. Couple of donations to report that are pretty cool. We received 2,000 cans of cold brew coffee from Scooters to keep our staff juiced up. Thank you. We received 2 big pallets of personal protection equipment yesterday from Harbor Freight. It's gloves, face shields, respiratory masks. Fantastic. One other thing I want to share on the donation front, and just a little commentary. Through this all, I know that there have been times when we've been maybe individually mad or frustrated. You've certainly seen maybe some frustration from me when we talk about testing and some of the misinformation that's been so prevalent out there. But I think mostly we're determined. There are some times that, frankly, it gets a little dusty in the room and our eyes get misty, and it's not usually from the heartbreak. Well, it is. It's from the heartbreak we see, but more often so far it's been from when our heart is warm. So with the kind of rise of Asian American violence that we're seeing out there right now, which is something that makes me mad and sad, I'm sorry that we all have to deal with it. I want you guys to soak in what I'm about to read from a recent donation. And in addition to joining us in our efforts to socially distance, hand hygiene, and so forth, I hope you're like Bryan and have zero tolerance for racism. So this letter accompanied a donation of 38 packages that was comprised of 1,900 procedural masks, 152 jars of hand sanitizer, 38 thermometers, and 190 tissue packs. And it came from the Vietnamese community in Lincoln. They wrote, "Dear Bryan, we know that your hospital is in need of the above items. Please accept these items as a token of our appreciation towards the medical team at Bryan Health. We know that these masks are not the most coveted N95 mask, but we hope these masks and supplies will ease some of your concerns, and most of all, bring love and support we have towards the medical professionals in general, and your hospital especially. We pray that the people in Nebraska, as well as everyone in America and everyone in the world, will be able to get rid of us of this terrible virus soon, and we will thrive again. Much love and respect and prayers for your medical team. Yours truly, from Viet Nguyen from VS Nails and Supply." There you have it, folks. Sara.
Good morning. I'm Sara Morris, Operations Director for the Bryan Physician Network. As Bob said, I've been with Bryan for over 20 years. Back on March 13th, we temporarily expanded our Bryan Urgent Care at Bryan's LifePoint campus so that we could safely care for community members with urgent, typical care needs, and at the same time provide a dedicated area for those dealing with respiratory symptoms possibly related to COVID-19. Our non-respiratory side is seeing things such as cuts, sprains, broken bones, and ear infections. we have taken great measures to make sure we are providing a safe environment to everyone needing care. With all the attention on COVID-19 care, I want everyone to know that we are daily caring for people with many non-respiratory symptoms. When you arrive at Bryan Urgent Care, located at Bryan's LifePoint campus on 27th Street, between Yankee Hill and Pine Lake, you will see two separate entrances. Just follow the signs based on your symptoms. Our patients have been very appreciative of having these two separate entrances dedicated to their specific needs. Both sides of our urgent care are open 7 days a week from 8 a.m. to 8 p.m. To date, our urgent care has tested 69 patients. We've had 2 positive and 18 are still pending. Thank you.
Thanks, Sarah. I'm John Woodrich, CEO of Bryan Medical Center. So I thought I'd just give you overall tallies when you look at the number of folks that we've tested at our drive-through, at our hospital, and at our urgent care. So to date, we have tested 684 people with the COVID test. 9 have been positive, 299 negative, and we still have 376 pending results. I did want to emphasize, a couple days ago I mentioned about our visitor policy going into place, and that happened this morning. So we have basically stated no visitors. We have a few exceptions that we stated a couple days ago. We'll continue to follow that. But in that same vein, we also have a valet service here that we will be discontinuing on Monday. So today will be the last day of that valet service. Part of that, a couple reasons. One, with less visitors, the need for valet has decreased, but also the risk of asking these individuals to go into somebody's car that may be a patient coming into the hospital is probably not the appropriate and safe thing to do. So we will be discontinuing that. I did want to let everyone know we continue to work on our surge plan. This morning I had a great session with the health department and the other healthcare providers in this community. So we have plans in place that as our surge continues, how we will handle the number of patients that are positive for COVID, but also the ones that we're ruling out because we want to make sure that we take care of individuals, but if they don't meet the requirements to become an inpatient, but yet we're concerned about sending them home, we're looking at other alternatives for that, and you'll see more of that in the near future. But I just want to express again the cooperation with the other healthcare facilities and with our health department has been absolutely outstanding and will really help us keep everyone safe. So I urge people again, social distancing, please do that. Avoid the large groups. It's what's going to help us be successful in fighting this virus. With that, I would offer anyone to ask questions via chat.
It's exactly what John referenced with the social distancing, hand hygiene. I spoke to Dr. Trapp this morning, who you guys have all heard from up here, and he wanted to stress that, you know, they're prepared, but they're most concerned about the asymptomatic symptoms and the spread that occurs there. So the social distancing from our medical staff, that's the most important thing you can do to help them at this point.
I think that's what we're seeing around the nation is that when it's all kind of balanced out, it's around a 3% positive rate. I think you're watching ours increase here in the community as we get more access to doing the test. And as you heard yesterday, we now have the capability from an analyzer perspective, and we're working with getting the reagents to then actually run the test here. So we are working with the health department on that and believe that we're probably within days of being able to perform the actual analysis of the samples.
With supplies right now, gowns are still classified as critical in the supply chain. Disinfectant wipes critical. Largely in part of our own efforts and then the generosity of the community. N95s are categorized as limited, ear loop mask as limited, hand sanitizer as limited. PAPR, reusable and disposables, shoe covers, and bouffant head cover and alternatives for head covers are all categorized as sufficient.
So we have been converting a number of our units to isolation units, and that means having negative pressure in those areas. And right now we're in good shape and continue to convert specific units to that. We have one unit specifically utilized right now for any rule out on COVID patients. We have not reached the limit to where we have to move into another unit, but we have them available at each campus and a surge plan for the capability of increasing units as the need arises.